So this slide, it depicts the sagittal section of the elbow joint, showing the coronoid fossa, the radial fossa and the olecranon fossa along with the synovial membrane and the capsule. Now we have fat pads located here. So they are above the synovial membrane and below the capsule of the elbow joint. That's why we call them extrasynovial but intracapsular. So supposedly this is the capsule and this is the synovial membrane. So we are going to have our fat pads. They will be located here. So they are extrasynovial outside the synovial membrane but intracapsular within the capsule. To visualize this, we maintain the home page view. And then we slide the probe medially towards the trochlea. Centering the trochlea on the screen, we will rotate our probe to 90 degrees and we will be able to identify the humero-ulnar joint. Now, keeping the same craniocaudal orientation, we then slide the probe laterally to evaluate the radiocapitular joint. So this is our home page view. So I'm going to slide my probe medially and I'm going to keep the trochlea at the center of the screen. Now I'll be rotating my probe to 90 degrees. And at the same time, I need to increase the depth also. So once I have increased the depth, I will be able to see something like this. So this concave shaped depression is the coronoid fossa, which is harboring the fat pads. This is the trochlea, which is having the hyaline cartilage over it. Then we have the pointed coronoid process, and what you are seeing here is the capsule of the elbow joint. This is the brachialis muscle in the longitudinal axis, and this one is your humero-ulnar joint. So we were here, okay. So now I'm going to keep the same orientation. That is, I'm looking at the longitudinal axis of the brachialis muscle, and now I'm going to slide my probe towards the lateral side. Maintaining the same orientation, I'm just sliding my probe. And once I'm sliding my probe, I will be able to see something like this. So now this concave shaped depression is the radial fossa, which is harboring the fat pads. This is capitulum with the hyaline cartilage over it. This square shaped structure is the radial head, and what you are seeing here is the synovial flinch, and this is the capsule of the elbow joint, and what you are seeing here is the radiocapitular joint.